Recently, monkeypox cases have been reported across multiple countries, and since July 2022, the World Health Organization has declared the virus a public health emergency of international concern. Monkeypox was first discovered in 1958 in monkeys in a research lab in Denmark. This is the reason scientists coined the term monkeypox. However, the source of the virus is more likely to be rodents. It was in 1970 that the first case of monkeypox was documented in humans. Since then, outbreaks have been happening for the past 30 years, mostly in countries in West and Central Africa. The reason why we did not hear about these outbreaks in the news is that the infection is occurring in countries where the disease is endemic, and it usually stays there. But things are obviously different this time. The virus is spreading at a fast rate, and cases are being documented all around the world. We don't know why this is happening right now, but there are several hypotheses. Scientists have already sequenced the virus in search of mutations making the virus more transmissible, but so far the virus looks similar to strains found in 2018 and 2019. It might take some time to see if a mutation increased its ability to spread, since the virus is huge and not as well studied as the coronavirus. But there is still a chance that a mutation has increased its transmissibility. Another factor is more and more people are not protected against monkeypox, making it easier for the virus to spread. Most people born before the 1970s actually had protection against monkeypox, thanks to the smallpox vaccine, which proved to be 85% effective against monkeypox. Smallpox was eradicated by 1980, and there was no need for vaccination programs anymore. Now, people born after the vaccination programs do not have this protection. This increases the likelihood of people developing symptoms and transmitting the disease. Add travel restrictions being lifted up and infected people attending large gatherings, the virus seems to have won a ticket to travel the world. How is it transmitted? Unlike COVID, which spreads primarily through the air, monkeypox transmission mostly happens when there is skin-to-skin contact. It can also be transmitted through direct contact with body fluids, an infected area like a rash, or exposure to contaminated objects like bed sheets, clothes, and towels. Monkeypox does not spread until people develop symptoms, so it is easy to recognize if someone can be contagious. Moreover, the incubation period ranges from 4 to 21 days. This provides ample time to prevent further transmission. The initial symptoms affect the upper respiratory system. It will feel like having the flu, so fever, body ache, fatigue, and headaches. As the body fights the virus, the lymph nodes swell. Then, the infected person starts getting rashes on the face, mouth, and other body parts. These rashes end up transforming into bumps filled with pus, which can be quite painful. An infection may last 2 to 4 weeks. It is not common to see outbreaks happening in many countries that are not endemic to the disease, but some scientists believe it is still containable. One thing that has been reassuring until now is that the monkeypox virus doesn't seem to mutate quickly to evade our defenses. That, together with the experience and contact tracing techniques emerging from the COVID response, increases the chances of containing the virus. And I hope epidemiologists and virologists are right on this one. Even more relevant, we have the smallpox vaccine that has an 85% effectiveness against monkeypox. And medications used to treat smallpox can also help treat monkeypox. This monkeypox virus, which is the West African strain, has a death rate of around 3 to 6% in endemic countries. People infected with monkeypox in high-resource countries do not usually lead to death, as they have access to the meds and care to control the infection. However, we still need to be careful. There are cases in where people suffered from severe infection and the virus disseminated to other organs. That is when it becomes more dangerous and may cause complications in the brain, lungs, and bloodstream, leading to death. People with pre-existing conditions may have a higher risk. For example, people with an immunocompromised state, like someone taking immunosuppressive medications, newborn babies, or pregnant women are all at higher risk of developing complications. People with uncontrolled HIV may have it worse. This can be worrisome since 13% of Americans with HIV are not aware that they have this diagnosis. I'll be working on videos explaining the current treatments and vaccines against monkeypox, so click the notification bell to get notified when those videos are out.